Good afternoon. My name is Lorna McGill, Lead Tissue Viability Nurse, and the purpose of this presentation is to introduce the UHD skin bundle for pressure ulcer preventative care. Pressure ulcers are among the top 10 harms within the NHS and also locally within UHD. The aim of the UHD-wide skin bundle is to standardise pressure ulcer preventative care and documentation across the trust, ensuring that each patient at risk has a personalised plan of care in place, written and signed off by the registered nurse. The UHD skin bundle highlights the need to alternate position from left to right to back and for offloading of the heels. It notes moving and handling aids in use, remembering that slide sheets should be available always for patients at risk. It reminds us about monitoring medical devices and also the importance of giving information to patients and their families about the risk status. This bundle acts as an aid memoir for staff planning and delivering care. It aims to give you the tools to help you ensure that care is systematically delivered and documented at each and every care intervention. This document will replace the previous Skin Bundle booklet, which has been in use on the Bournemouth site, and the Skin Bundle Care Plan and Repositioning charts, which have been used in Pool. You're all already familiar with the aSSKIng of the Skin Bundle. This new UHD version has simply added the A for Assess Risk, and you already complete the purpose T, and G for Giving Information. This reminds us all to ensure that patient education and advice is given together with the patient information leaflet, and affords the space to document this concisely. I will now work through each of the elements of the bundle and plan of care, and I've highlighted the parts from the skin bundle front page in yellow for ease of reference as we work through. A for Assess Risk. The purpose T must be completed on ENA within 6 hours of admission to hospital. It should be updated weekly on any change in the clinical condition or transfer between wards. Just to point out that the most common error seen with the Purpose T documentation is under the current detailed skin assessment, where occasionally staff document all bony prominences as vulnerable in the orange category. Remember, this is a detailed skin assessment at that point in time, and vulnerable skin would relate to an area of erythema or deep tissue injury, as opposed to just general overall frailty, fragile skin. The Purpose T audit tool is now a live link within the tissue viability section of the intranet, and this affords the opportunity to complete an audit of 6 patients' Purpose T assessments to ensure that the completion is accurate and that the appropriate actions have been taken depending on the red, amber or green pathway. On the Skin Bundle booklet, the A for Assess Risk simply reminds us that those on an amber or red pathway must be on a skin bundle. The S is for Skin Assessment. The Purpose T has already detailed a full skin assessment of all bony prominences. The body map should be completed within 6 hours of admission, and this will include any damage to the skin, such as pressure areas, moisture-associated skin damage, bruises, cuts, or trauma wounds. This section on the new skin bundle simply reminds us to document any changes on the body map and to report all pressure damage of Category 2 and above via Daytex. Those patients with Category 3 or 4 damage will also require a tissue viability referral, which is made via EPR. S is for Surface. When we think of surface, we need to think of both the support surface, the mattress or the cushion on which the patient is resting, and also any devices which we have placed on the surface of the patient's skin. The support surface selection guide is available on the intranet under T for tissue viability and within the equipment section. Remember that there is no mattress or cushion which will alone prevent pressure damage. These are just tools in our toolkit to aid us with pressure relief. It is the repositioning and offloading which will prevent the pressure damage from occurring. Any medical device in use should have a plan of care and be regularly checked and the skin condition underneath monitored where possible.
The surface section of the skin bundle directs us to note the mattress and pressure relieving cushion in use. Remember, if we're using the AreaFlex non-powered mattress, it must be disconnected from the pump. The blue tubing should be stored along the side of the mattress in the loops provided for this purpose. We also have a trigger to record how the heels are to be offloaded from pressure, and as medical devices have the potential to cause pressure damage, a section to detail any devices in situ, how often they should be checked, and if they are no longer in use.
The K is for keep moving, where the frequency of planned repositioning is documented. Remember that this will be dictated by the individual's skin response. If the skin is noted to be red and marking after 4 hours, increase the frequency of repositioning to 3 hourly, for example. Any individual at risk of pressure damage should ideally be seated for no more than 2 hours at a time, but again, this will be titrated for each individual patient as their skin and comfort dictates. Slide sheets are of paramount importance when repositioning a patient within the bed, as they reduce friction and shear on the skin. Patients should never be moved on a sheet, and if promoting independence of mobility, slide sheets can still be placed under the patient and then them encouraged to use with those in situ. The 30-degree lateral tilt is optimal with a head elevation of up to 30 degrees and the use of the knee brake function. Again, to reduce shearing forces and from the patient sliding down in the bed. There is an SOP on the use of the 30-degree lateral tilt position if further information is required. The I of the skin bundle relates to incontinence or increased moisture management. Sources of moisture can be from urine or fecal incontinence, but can also be from insensible loss or sweat, or simply wound exudate or saliva. The pH levels of the skin directly affects its health and quality. Sweat, sebum and our normal skin flora maintain the acid mantle with a pH between 4 and 6.5. Urine and feces contain urea, ammonia and bacteria, which will alter this pH, making it much more susceptible to breakdown. For instances of moisture-associated skin damage, cleanse with Tena and apply Mediderma S barrier. Also ensure that patients are never nursed on the blue attends procedure sheets. If needed, use an incontinence pad. The I section of the bundle simply provides us with an aid memoir to these factors. The N for nutrition. The provision of nutrition and hydration is a fundamental aspect of care. While poor nutritional intake does not notably increase an individual's risk to pressure ulceration, optimal nutritional intake is of paramount importance for healing of any damage acquired. All patients with Category 3 and 4 pressure damage must be referred to the dietitian to ensure a specialist assessment of intake and their requirements is carried out. The N on the skin bundle plan of care affords the space to document any special dietary requirements and if a dietetic referral has been submitted. G for giving of information. Any plan of care should, where possible, be formulated in agreement with the patient or their loved ones. It is important that the patient knows what they can do to help to prevent pressure damage, and also the rationale behind our interventions, such as repositioning. Giving information in both written and verbal formats is an important part of pressure ulcer preventative care. The information leaflet is available on the Patient Information Leaflets database and should be printed out available on your wards for new admissions. It may even be given as part of an admission pack. The G on the skin bundle gives us a place to clearly document what information has been given and in what format. The bottom of the skin bundle plan of care affords a place to date, time and sign it. All care planning is the responsibility of the registered clinician. Whilst it is widely acknowledged that our healthcare support workers carry out a lot of the personal and pressure area care, it is imperative that this plan is developed and documented by the registered nurse. Following the initial day when the care plan was documented, each subsequent page includes space requiring the RN signature to confirm that there has been a daily review by the RN and that the care plan remains appropriate. Having the individualised plan of care completed by the RN, we will now move on to look at the pages of the skin bundle booklet. Each booklet will cover a 6-day period. So this page that we see is duplicated 6 times. The personalised plan of care must therefore be updated when a new bundle or booklet is commenced. We will look at this page in a little more detail. So to begin with, we have the date and a part referring to heel offloading, giving the options of yes, no or not applicable. Is the electric mattress working? Again, yes, no or not applicable. If the mattress in use is non-powered, then this will obviously be NA. Under hygiene, we have the key at the bottom of the bundle to note if the patient has been dry, wet, incontinent of faeces, and a section for the skin check where we will note the skin condition at that time. The entry should be signed by those delivering the care. The repositioning codes have been put into the bundle for staff simply to circle the appropriate position code. It is anticipated that this will reduce instances of staff simply writing "sat up the bed" for consecutive time periods. The aim is to have the patient nursed in an alternate position to that previously. If seated in a chair for 2 hours, ideally return to bed in a side-lying tilt position to offload the bony prominences in the bottom. Throughout each day of the skin bundle documentation, some pre-printed entries are marked with a red asterisk. If selecting an asterisked option, such as declined, heels not offloaded, or electric mattress not working, there must be an escalation documented as to what has been done to address this issue. If a patient is seated in a chair with their feet flat on the floor, then heels offloaded can be marked as not applicable. However, while supine in bed, a pillow should be placed underneath their lower legs to ensure zero pressure to the heels. If any new damage or concerns are noticed whilst carrying out the skin check, these must be escalated to the registered nurse, who must then assess, document and action as required. Remember, a picture tells 1,000 words. Ward-based patient photography SOP has now been published and the link for that is included in the final slide for ease of reference for how you can take your photographs on EPR. The final page or the back page of the skin bundle booklet allows space for freehand documentation of any variances or escalations. This could be used to detail if a patient has been declining care and the reasons for this, any information given, the patient's level of understanding or capacity, and any escalation can be documented here. At the bottom of the page, there is a pictorial reminder of the definitions of categories of pressure damage and a few other points to note, such as a DTI will be documented as vulnerable skin on the purpose T, unstageable damage will be detailed as category 3 unless proven otherwise, and a reminder about the importance of differentiating between moisture associated skin damage and pressure damage in order that the appropriate preventative plan of care be implemented. The skin bundle can be ordered from the print room. The email address is shown here. Please include contact name and email address, which ward or department, and the relevant cost code. Also where the items are to be sent to, as the print room is based in Poole Hospital, so will be sent in internal mail. Always remember that skin deprived of oxygen will, of course, begin to die. Regular change of position and offloading of any affected areas is the key to pressure ulcer preventative care. I've included the links to some of the associated documents which form the basis for this presentation. If you have any queries, please do not hesitate to contact me. My email address is shown below. Many thanks for your attention.